Is it more stressful now, or was it more stressful last year?
It's different. The other way was a bit surrealistic and unreal craziness. The idea of seeing the divisiveness.
Are you going to allow the government to tell you you have to wear a mask?
It would almost be funny if it wasn't so tragic.
The White House called Fauci's comments unacceptable.
It's kind of like being in a world war, and instead of fighting the enemy outside, the Army and Navy are shooting at each other.
Where are we going to see you in 10 years?
Let's hope I'm alive. That's a good start.
Hey family, welcome back to the show. It's Carlos Watson. We have a great show tonight. My guest needs no introduction, but damn it, I'm going to do it anyhow. Dr. Anthony Fauci. Now, maybe one of the most talked about people around the globe over the last year. He was an early guest on this show, and now he's back. Breaking news, saying some unexpected things, making a bold prediction about all of our futures. I think you're going to enjoy this conversation. Brooklyn's own Dr. Anthony Fauci. Dr. Fauci, nice to see you again.
Yeah, same here. Really great to be with you.
Yeah, how have you, I feel like asking you how you've been, but in a weird way that feels almost, I don't know what to call it, inappropriate?
It's not inappropriate at all. I've been fine. You know, it's, to say it's not stressful is to be not honest, but I've been there before, so I'm okay.
Is it more stressful now, or was it more stressful last year?
It's different in the following way. The other way was a bit surrealistic and unreal craziness. This is a lot more work because we really are taking the response very, very seriously. So the amount of hours, I mean, every day, there's no difference between Saturday and Sunday, between morning and late night. It's just go straight through. This is a serious pandemic and you got to treat it like you're at war.
Are you better equipped to make a difference now than you would have been at 50, do you think, in any way?
Yeah, I think the cumulative experience that I've had advising 7 presidents over the last 40 years, getting involved in major outbreaks from HIV, which was the mother of all outbreaks, and then Ebola and Zika and pandemic flu and the anthrax attacks. Each one you go through, each ordeal that you go through, you get more and more experience and your instincts get better and better instead of less and less. We need to continue to build up our local public health infrastructure, which over the last decades, we have let to actually, in many respects, go into disarray.
Dr. Fauci, how has this last year and a half changed you personally, if at all?
I am still the same person, but the experiences have been really very unique. I mean, the thing I keep bringing up when people ask me, the idea of trying to do your best to contain a global pandemic, the magnitude of which has not been seen in well over 100 years, that's killed 575,000 people in the United States, that's ravaged our economy. And yet, in the middle of all this, I've never been involved in politics. I'm anybody that knows me, I'm about as apolitical as you can get. But the idea of seeing the divisiveness in our society that is a hindrance to responding adequately and appropriately to a deadly pandemic, in some respects is discouraging.
The time is now. It's time for action. Thank you guys very much.
In some respects is mind-boggling to me how we can see people all around us dying and getting hospitalized, and the common enemy is the virus, and we're still fighting with each other.
CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure. So it's voluntary. You don't have to do it. I don't think I'm going to be doing it.
This whole issue of fake news and conspiracy theories. I mean, people actually thinking we're putting chips into vaccines when we inject it into people, you know, and people thinking that we created the virus because we wanted to see this happen. I mean, it's really, you know, it would almost be funny if it wasn't so tragic.
I can't breathe.
So I don't think it's changed me, but it has really brought me into an arena that I never would have imagined in my wildest dreams.
Well, good morning, Tony. The president appeared once again to openly toy with the idea of firing Dr. Anthony Fauci.
Don't tell anybody, but let me wait till a little bit after the election.
It's kind of like being in a world war, and instead of fighting the enemy outside, the Army and Navy are shooting at each other.
What would President Trump say to you in quiet moments when it was just the two of you guys?
You know, the reason I don't want to answer that, Carlos, to be honest with you, because anytime I say something that has to do with that, it is responded by attacks.
Fauci said the president's looking at the virus from the perspective of reopening the country, while the Biden campaign is taking it seriously from a public health perspective. The White House called Fauci's comments unacceptable and accused him of being partisan by praising the president's opponent.
When you and I talked last, you told me that this hasn't been the first pandemic and it's probably not the last we're going to see. So given that we may sadly be back in some version of this again in the not too distant future, what should we have done differently last year?
The idea of wishing that it's going to go away is not the right response. And the resistance that we have seen to shutting down and the restrictions we've put is something that is so counterproductive that the next time we get an outbreak, we got to realize that even if you have disagreements ideologically, and this country is a very divided country, you have to pull together against the same common enemy.
What do you see when you look at India at the moment?
It's a very tragic situation because they are having, at a scale that's unimaginable, suffering disease and death, which is bad enough in and of itself under the best circumstances. But when you have people in the street and in storefronts when they should be in a hospital, when you have oxygen running out and people literally dying in front of you, that's something that is so terrible and so tragic. So, you know, they have 2% of their country vaccinated. When you have a country of 1.4 billion people, count the number of people that are not vaccinated.
I spoke at length with Modi, Prime Minister. We are sending immediately a whole series of help that he needs.
When we stepped forward, the United States, to give them oxygen cylinders, oxygen generating capability, supplies to make their own vaccine, personal protective equipment, drugs like remdesivir, that absolutely was the right thing to do.
When I hear you describe that and I think about the sheer numbers, and you've talked to me about how interconnected the world is, should we do even more, do you think, in this moment?
First of all, you got to admit that we've done a lot more than any other country. So if anybody in the rest of the world wants to criticize us, you just take a look at the data. We've actually done a lot. However, being a rich and generous country, I believe we can do more.
We're also discussing, I've discussed with him, when we'll be able to send actual vaccines to India, which will be my intention to do.
How worried are you about what is happening in other parts of the world, meaning significant flare-ups happening here in the U.S., despite the fact that I guess more than half the population now is vaccinated?
I'm not so sure we'd have a flare-up, but I think what it will do, it will hinder our ability to completely crush the outbreak. However, if you keep getting variants that are generated and emerge in countries that don't have good control, there's always the risk and the potential of those variants coming here. Fortunately, thus far, we've been lucky enough that the vaccines that we are using work reasonably well, sometimes extremely well. But if you keep tempting the system and getting more and more variants, sooner or later, you might run into a variant that you're not going to handle very well with the vaccines. When there's activity anywhere in the world, there's a threat everywhere in the world.
Obviously, lots of young people are watching. What would you say to those young people?
Well, what I would hope the young people do is to realize that they really do need to get vaccinated, because if you look at the the percentage of people that are not getting vaccinated. They're disproportionately young.
What I'm worried about is people who aren't taking it, frankly.
Ohio, Kansas, Mississippi, and Georgia have the lowest vaccination rates in the country.
Even though young people, understandably but not completely correctly, think that they're essentially exempt from getting serious disease. We get plenty of young people who get infected, who not only get serious acute disease, but also have the lingering effects of the disease long after it essentially clears up. So you want to do it for yourself, you want to do it for your family, but also you must realize that you have a societal responsibility, because if you get infected, you could still, and it happens all the time, inadvertently and innocently pass the infection on to someone else who could have a serious outcome. So in reality, you're part of the propagation of the outbreak as opposed to a solution.
Dr. Fauci, are there any things about the vaccines that are troubling?
No, actually, it's interesting that these vaccines are remarkably safe, as are most all the vaccines that we give. Very, very, very rarely do you get a serious adverse event, but it is so rare that often it's less of a likelihood that you're going to get struck by lightning. Really, I mean, it's that rare. It's not zero, but it's very, very, very rare. So the benefit from getting vaccinated overwhelmingly is better than the risk and overcomes the risk of any adverse event.
What's a medical breakthrough that you think we might see in the next 10 years that at least part of the credit may go to everything that's happened in the last 18 months?
You know, I think the success that we've had with developing spectacularly successful COVID-19 vaccines might help us with the breakthrough of developing an HIV vaccine.
Oh, that'd be spectacular. Dr. Fauci, the last year not only saw COVID and an election, but we also ended up having a real conversation about race in the country. For a New Yorker like yourself, what, if anything, did you learn in the last year, or what did you come to think on questions of race, given the conversation that emerged?
Well, what COVID-19 did, as with some other diseases do, it shed a bright light on the disparities of health access, and complications of disease, particularly African Americans, Hispanics, and Native Americans have. First of all, by the very nature of the jobs that many African Americans and Hispanics have, namely they're outside in the community doing essential jobs, they have a higher incidence of getting infected than the general population. Once they do get infected, because of the decades and decades long social determinants of health, they have a higher incidence of the underlying comorbidities that make it more likely that they will have a severe outcome with hospitalization and death if they do get infected. And those comorbidities are things that are not racially determined, but it's determined by the conditions under which people in the minority groups live from birth. And that could be lack of access to an adequate diet, that could lead to obesity or diabetes, hypertension, a variety of things that clearly are associated with a poor outcome from getting infected.
Given that, what do you hope will happen? What are some of the things that you would put on the table to change that kind of racial disparity?
I think we need to make a decades-long commitment. I mean, there are things you can handle immediately, but if you want to change the social determinants of health, you've got to make a commitment now that as a nation, we're going to correct the wrongs and undo them that really took decades and decades and decades to happen. So you can't say, okay, we're going to do something for a year and forget about it. It's got to be, you got to turn around the underlying causes of the social determinants of health. And I hope that our nation is ready for that.
Dr. Fauci, last time you were here, we had a little bit of fun with rapid fire. I want to do a little rapid fire with you. Do you mind if we do that again?
Sure, go ahead.
You told me that Steph Curry was your guy. Who's Dr. Fauci's starting five?
Well, it would have to be Bob Cousy as the number one, Steph Curry's number two. Then you got Michael Jordan, number three. I guess it would have to be Kareem Abdul-Jabbar. Wilt Chamberlain would have to be in there.
So you left off LeBron and a few others, but
you didn't give me enough time, Carlos.
Dr. Fauci, what's your karaoke song?
"Staying Alive" by the Bee Gees.
I love it. Now, were you in Studio 54 back in the day? Did you ever make an appearance in the disco era?
I was too busy doing medicine in my residency.
What's your favorite TV series?
It's close. It was NYPD Blue I really liked. But you know, Chicago PD is really good right now.
Chicago PD.
Would you have been a cop in another life? Did you ever think
about
about that?
Yeah, I could have been.
I could see you as a detective. Who should play you in a movie?
Last year, somebody had just joked around and said, "Who would you like to play you on Saturday Night Live?" And I just, off the top of my head, I said one of my favorite actors is Brad Pitt. So I said Brad Pitt. The next thing I knew, Brad Pitt was playing me on Saturday Night Live.
I'm Dr. Anthony Fauci. First, I'd like to thank all the older women in America who have sent me supportive, inspiring, and sometimes graphic emails.
Your favorite movie of all time?
Godfather Part 2.
Fredo, you're my older brother, and I love you. But don't ever take sides with anyone against the family again.
Dr. Fauci, where are we going to see you in 10 years?
Well, let's hope I'm alive. That's the first, a good start. I would like to see myself enjoying my children and my grandchildren and just chilling out after so many years of intensity. I'm a pretty good writer, so I'd like to write, maybe some books and see what happens.
Are you going to retire anytime soon, you think?
It's not on my radar screen yet, that's for sure.
Perfect. Dr. Fauci, thank you so very much again. We really appreciate you.
My pleasure. Thank you for having me.
Who wants to be in on this?
So I enjoyed the interview. I love Fauci. But I haven't really been too keen on wanting to take the vaccine.
Did he persuade you, though?
I'm much closer than I was to doing it, especially after listening to Fauci.
3 months into the pandemic, everyone was glued to their televisions and we were all watching Fauci, right? And like a year later, we're still watching Fauci. I've read every article there is. I'm the anti-Monica. I was like, let's go anytime. I want that vaccine. What's not to like about just a little dude from Brooklyn, right? Right. He's a doctor, but it also feels like he might know some guys. Right. But Fauci was good. I'd love to see. If we can get him to sing a karaoke song, then I'm down.
Then he would. Okay. All right. Good. Oh, good. All right. Thank you. Hey, I hope you enjoyed that conversation with Dr. Fauci. What an interesting guy. I hope he's right about a possible HIV vaccine. What a game changer that would be. We'll see where things go from here. All right, listen, if you want more of the good stuff, be sure to hit the subscribe button. Also, listen to our podcast, something really beautiful in that. Thanks for watching The Carlos Watson Show. Be safe. I'll see you on the other side.